Right. So today I was tasked to talk about getting into non-clinical careers. So here I thought I'll just break it down to something simple, which you guys can immediately implement to get started if you are thinking about moving into a non-clinical career. So here are the three things that you need to know. However, before we start, I think I need to clarify what clinical and non-clinical means. So clinical basically means it's a patient-facing side of medicine where you actually require your APC because you'll be prescribing, you'll be doing procedures, you'll be consulting patients. So you are required to have your APC. Non-clinical, however, is a non-patient facing part of healthcare. And whether you need an APC or not, it actually is very dependent on the role that you're in and the company that's hiring you. See, some of them may want a medical director with a APC. Some companies may not. So it's very dependent, but as a rule of thumb, in a non-clinical sector, you actually do not require an APC. So, okay, before that, I think I need to tell you guys that sick care is not healthcare. Now, the reason why all of us, myself included at one point of time, felt really stuck and that there's no other opportunities for doctors like us was because we're all trained in sick care, not healthcare. So I'll just some food for thought. If a health patient came to you and saw you in a hospital, what would you do? Well, if a healthy patient came and saw me in the hospital, first, I'll get really pissed off. Then I'll try to settle this patient and send him home and tell him not to come back unless something has happened, and then probably bitch about him to my colleagues, right? So if a healthy patient comes to you, you won't know what to do. And neither did I back then because I wasn't trained in it. So technically we are not healthcare worker, we're more of a sick care worker, right? But if you leave sick care and jump onto the healthcare bandwagon, you'll actually see that there's abundance of opportunity out there. So this is actually what healthcare really looks like, right? So where we are, we've been only playing in this field, which is all the sick care that we know of. But there's wellness, prevention, there's all this other kind of medicine, humanitarian medicine, diving medicine, osteopathic medicine, and this is non-clinical sector of healthcare, which actually all of us would never be exposed to unless we stepped out of it, stepped out of our comfort zone, out of our sick care. Then that's only when you'll actually see this, right? So the question here, so here it's not about sick care is better or clinical is better. There's no such thing as that. This whole thing, everyone needs to work in tandem. We all have to pull our weight. Then only this whole thing in healthcare works, right? So right now we think we're pulling all the weight, but we've not seen what these guys are doing, what these guys can be doing, what these guys can be doing. So I've heard a lot of specialists saying that, oh, aesthetic medicine is not medicine. So the reason they say that is because they're still playing in this field. No one is seeing what's in here. What is aesthetic medicine? What is wellness? What is prevention? So just to open your scope, this is actually where the opportunity lies, right? But with all this opportunity, the question is not what is out there, but rather how do you choose what's right for you, right? So when I was, after I left clinical medicine, I went to IMR. So many people, there were a few people who told me that research is not for everyone, but nobody elaborated, right? So today I was tasked to talk about getting into non-clinical careers. So here I thought I'll just break it down to something simple,